Hi, everyone. I am so pleased to be here to share this research. Thank you to the NCCEH for the opportunity to present and to all of you for taking the time to join the conversation. For the environmental health practitioners who are here today, I hope you're having a very good environmental health week. I'd like to begin by acknowledging the land where I live and work, which is in the city of Temiskaming Shores within the Algonquin, traditional and unceded territory, of the Algonquin people, specifically Temiskaming First Nation. My research interest began in this place near where I grew up and where I have worked since 2006 in local public health. Today, though, I'm joining you downriver from there as a guest on the unceded, unsurrendered Indigenous territory of the Anishinaabe Algonquin Nation, where I've been attending a National Emergency Preparedness and Climate Adaptation Conference. I'm grateful for the opportunity to visit, learn, and am doing my best to treat this place with care and respect. During this webinar, I'll be speaking about a research project I carried out as part of my doctoral program. The project was funded by the Canadian Institutes of Health Research as a 2021 Catalyst Grant linked to that year's Chief Public Health Officer report, A Vision to Transform Canada's Public Health System. I'm grateful to have been part of this research team, and I thank the members of our advisory committee who provided advice throughout the project. I'll start by giving some background to the research, then briefly describe the project itself, and get right into our recommendations. Now, if I had to suggest what key takeaways might be, it would be these. The first is that we can do better for rural Canada. This research offers recommendations on how to do just that. Next, if we want to support well-being, we need to broaden the viewfinder, not just think about health or just about emergencies, but think about health in the context of disruption and about emergencies' impacts on health. And third, it would be the importance of working across sectors. Nobody owns the work of preventing, preparing for, or responding to emergencies. It's an all hands on deck type of situation. Now, in Canada, in 2021, 18% of the population lived in areas with fewer than 1,000 people. As we increase to communities with 10 or even 30,000 people, which many still consider to be rural, this population increases to up to 29%. And the population of rural Canada is growing. These rural Canadians do not have the same experiences as their urban counterparts. These are older populations and they face service, digital, and physical isolation. In other words, our internet is more expensive, there are fewer services, and more barriers to accessing them, and we're generally farther apart from one another. Rural Canadians overall report poorer health outcomes. We exhibit some positive traits as well, like increased social cohesion and lower rates of depression. If you add COVID to the mix, and of course, well-being was impacted all across Canada, and not just related to the COVID virus itself, but other aspects of our health. But in rural communities, each of these impacts was amplified or at least experienced differently. In other words, emergencies like COVID have significant impact on health in rural communities. Impact that is often due to pre-existing conditions like social isolation, inadequate income, and more. Rural communities are always changing. Change can happen gradually, or it can happen suddenly. Rural communities are close to nature, and this puts us on the front line of climate change impacts as well. And our distance from urban centers can affect our ability to respond when an emergency hits. Now, this sets the framing for our research, thinking about well-being in rural communities in the context of change. Now, to do this, we dove into the language and tools of emergency management, but with an eye to what this means for health. And it is this is in contrast to how we often in emergency management distinguish between blue sky versus gray sky times. This is the emergency management cycle. It's often shown as either a 4 or 5 phase cycle, depending on where you are. Phases are prevention, mitigation, preparedness, response, and recovery. Now I will tell you a little bit about the specific region where our research took place, Northern Ontario. Northern Ontario is typically divided above where I've added this black line. Here we're reminded that Northern Ontario covers 90% of Ontario's landmass with only 6% of our population. And we have more chronic disease and live on average 2.5 years less than in the South. We have fewer physicians, and our lives are more intensely shaped by issues like weather, infrastructure, and location. And to those who may be thinking only 6%, why so much ado about so few people? I'll say that we know that inequities bring us all down. When some in our population are doing less well, it affects everyone. And also, Northern Ontario is the source of resources that benefit the province as a whole and the nation. So when this region is doing well and thriving, everyone is better off. The purpose of our research was to learn from COVID to see how we might help rural communities reduce the impact of future types of disruption. This could be from another pandemic, extreme weather, economic disruption, or any other type of change. We were able to recruit 7 municipalities to participate in the project, which had 4 phases. First, we reviewed council agendas and minutes from the first 6 waves of the COVID pandemic to learn about each participating municipality's experiences during that time. This informed interview scripts for conversations with municipal representatives, both staff and elected. Themes from these interviews informed interviews with representatives from local public health units and other organizations who had a role in the local pandemic response. Next, we hosted an in-person workshop where participants worked together to make preliminary recommendations. These were then compiled with recommendations that had been made along the way during the interviews and with insights from the literature. Now, the purpose of this research was to be useful and timely. So a report and policy brief have been published this week, and we are able to share the policy brief with Emergency Management Ontario as part of their engagement on modernization of provincial emergency management legislation. We'll also be working through the fall to write papers for publication. I'll now jump straight to the recommendations that have come from the research as a suite of 4 recommendations with 19 sub-recommendations. Multiple levels of government, the public health sector, and communities themselves have roles in their uptake. The first recommendation is that we clarify the emergency management framework. And this is to review and standardize emergency management documents to ensure clear definitions and consistency for each phase. I mentioned earlier that emergency management has 5 phases. In discussing these with key informants, we learned that people hold very different understandings of each of the phases, what they mean, how they're different from one another, even when they occur. It's easy to see how this can be the case. In reviewing emergency frameworks for Ontario and for Canada, definitions carry enough subtle and sometimes not so subtle differences to sacrifice important clarity. Furthermore, the preparedness and response phases of the cycle are provided significantly more attention and resources than prevention, mitigation, and recovery. Also understandable, we're driven to respond to acute, urgent occurrences, but nonetheless, prevention and mitigation are essential to preventing events from occurring and to reducing the impacts of events that cannot be prevented. In Ontario, legislation reinforces this, requiring preparedness and providing funding for response. A second point here is to include social emergencies into the existing emergency management framework. Emergencies have historically tended to be considered as large, acute events, but increasingly we have crises in our communities that don't fit this description and that are having large emergency scale impacts and deserve the type of collaborative response that's enabled within the emergency management framework. Examples include the opioid crisis, food insecurity, and homelessness, all things that were put aside when the pandemic hit. Now, where our focus on the COVID pandemic was primarily on the virus itself, we now know the incredible and enduring social impact that it had. So embracing both the social dimensions of emergencies and social emergencies themselves can help us use emergency management to more effectively address the things that are affecting us. And lastly, rural communities recommend clearly outlining the roles and responsibilities of everyone involved, including municipal governments, local public health agencies, and nonprofit organizations. Among key informants, there's acknowledgement that many have a role, but there's really inconsistent understanding about role definition, especially across sectors and organizations. Increasing clarity would help people in rural communities to better understand their lane, so to speak, and then to collaborate more effectively. The second group of recommendations relates to increasing capacity as a whole system for emergency management. Now, there's a lot in here. This includes regularly updating and delivering training on the entire management cycle, not just preparedness and response. This includes decision-making, risk communications, even developing quality, healthy public policy, and addressing health inequities, and also working to improve health and social media literacy among our populations. There's a lot packed into that, but when the focus has been limited for so long to such a small portion of the emergency management cycle, and when training for even those sections hasn't been enough, then there's a lot really that can be done. Next, rural communities already benefit from access to centralized resources. In Ontario, Emergency Management Ontario plays this role, as does the Red Cross, for example. Rural communities would benefit from these being broadened to include ongoing access to expertise and a deployable team to assist rural communities during crises. Because rural communities are challenged to up staff with expertise in all areas, they would also benefit from centralized policy supports related to all phases of the emergency management cycle. Rural communities would like to see funding models redesigned to encourage collaboration, reduce some of the barriers they face in having capacity to even put together an application. Funding also needs to recognize that costs are higher in rural areas, especially cost per person. And again, recognizing cost limitations due to very small tax bases. They may need flexible access to loans and even ongoing funding for rural emergency management, including dedicated roles, infrastructure, and investments across all emergency management phases. Rural communities would benefit from engaging civil society, including nonprofit groups and the local private sector, as active participants in emergency management in all phases. In all these phases, we have seen rural people have shown that they want to be involved, that they step up when they're needed. So using a whole of society approach in more formal ways can increase local capacity without additional financial resources. Rural communities also recommend developing standardized communication tools and language to take time to build trust in our spokespeople and practice using diverse channels to get the word out. We heard that although people got through during COVID, existing plans and expertise just were not in place or enough in this area. And lastly, rural communities recommend strengthening local public health as a key partner in supporting well-being during all phases of emergency management, as well as expanding key legislation so that it mandates the involvement of more people and adds focus on prevention, mitigation, and recovery, not just preparedness and response. The third set of recommendations is to build understanding specific to rural emergency management, because we've learned that things just look different in rural communities. Each rural municipality is so small, with as few as one staff person who wears all the hats. Training programs that address the unique challenges of rural emergency management can also help those in urban settings better support those in rural ones. Training needs to factor in the realities of rural life, like that some places don't have good internet or cell service, or factor in that the older population demographic, and the distances between communities, and challenges when only one road is in place and it's closed due to weather. Rural communities have learned to collaborate to get important work done, and so fostering this collaboration will also help, creating a regional community of practice to share skills, experience, and knowledge. They can even conduct joint exercises and use a shared emergency management coordinator across several communities, sharing limited resources among themselves. And in general, intentionally fostering regular networking and information exchange among all the organizations with a role to play. This is both to foster all the phases, but also so that when a response needs to be mobilized, the relationships are in place to do so. Our last recommendation is to modernize emergency management strategies, and this reflects the adaptations that took place on the ground during COVID, because the tools and trainings that were in place weren't necessarily a fit. It's in part to recognize that rural communities just don't have or can't be expected to have many of the resources that exist in urban ones. Using asset-based and strengths-based methods throughout the emergency management cycle can help to recognize all that is currently in place, resources that can be mustered when needed, that we often ignore. And in the context of truth and reconciliation and recognizing Indigenous history on the lands where our municipalities are located, calls us to also support local Indigenous organizations and to consider the impact of hazards and emergencies on Indigenous people and on the land. And then there are ways to modernize the approach, how we approach each of the phases of emergency management. In prevention, we can invest more intentionally in factors that reduce vulnerability, such as transportation, housing, healthcare, internet access. We know these are issues, yet we continue to be distracted by downstream, more acute issues without balancing our investments in upstream prevention. This means also promoting healthy environments and supporting local efforts on issues like climate change prevention. In Ontario, where community safety and well-being plans have been mandated, these offer a really good tool with which to identify and address local risks. Communities and organizations often do a HIRID, or a hazard identification and risk assessment exercise, to identify local hazards and risks. Making sure to include social risks and vulnerabilities in these assessments can help communities recognize the things that are making them vulnerable within disruption. And also, when considering hazards, think about them in all levels of society, on individuals, on communities, broader societies, and on the ecosystem. And then looking to mitigate all kinds of risks can build in the whole area of climate change adaptation, which is well known to be a fiscally responsible approach. In preparedness, additional planning for community-specific needs can then lessen their impact. Things like transportation and healthcare and supply chain challenges. Engaging civil society, especially vulnerable populations, in preparedness work and sharing plans with the community can also help with buy-in and then strengthen the plans. Regularly conducting exercises with diverse partners exercises that focus on complex scenarios, and then even practicing the use of response tools like the incident management system and communications plans are also important. Some of you may be thinking, of course, we're supposed to practice, but we learned that it's not happening. And so we're trying to give voice to the need for systems that ensure these things are given greater priority. The idea of modernizing is also to recognize the drawn out social impacts of emergencies and that they're increasingly layering on top of one another, as well as the increased desire to pay attention to equity during response. To do this, some of the tools we use during response need updating as well to address more complex emergencies, compounded emergencies, and that facilitate the integration of diverse perspectives that also allow us to mitigate short and long-term consequences of the response measures themselves, and also that support learning and reflection in real time. We can't wait until the end to think about reflection and change because the response is so drawn out. And our tools need to adapt to varying levels of participation and knowledge. People come and go during the response, and people have varying levels of knowledge that will then impact how they shape the decision-making that's happening. And we need to be able to talk about and address power dynamics within our response efforts. And finally, we need to stop skipping recovery, and we need to make it meaningful because this is such an important time to reflect and to heal and to make brave changes to prevent whatever we've just gone through from happening again. I've already talked about clarifying what recovery even means and about the opportunities to increase its importance through legislation. So this is things like debriefing sessions and thorough documentation of lessons learned. Holding collective debriefs across organizations or regions can promote shared learning and improvement. And then truly holding ourselves accountable for investing in those lessons learned. So returning to our takeaways, I hope I have successfully made the case that there is much we can do to better support rural communities in thriving through change. And that if we zoom out to see the connections between structural factors and their impact in the context of change, or to see that change is ongoing rather than only large-scale disruptive events that happen and then go away. And if we see the potential for all the people in our communities to play a part in strengthening communities, then we're more likely to see rural communities not only less impacted by extreme events, but also potentially fewer extreme events. Beyond the local level, policymakers shaping rural life tend to be located in urban areas. Rural communities will benefit from those urban decision makers knowing more of the realities of rural life and emergency management in this context. This research took place in rural Northern Ontario, but rural communities across Canada share many challenges. Small local governments, unequal investment in emergency management, proximity to natural environments, and colonial histories. So thank you all for taking the time to join today's discussion. I'd like to express my very sincere thanks to research participants who were willing to revisit what was for many a time of uncertainty and extreme stress, and to the people and organizations who have supported the project. I have been just reading Jane Philpott's new book, Health for All, and she quotes Winston Churchill as having said, quote, "Never let a good crisis go to waste." And I agree with them both. The type of disruption that we experienced through COVID really does offer us a chance to learn and to do better. And I hope this research contributes to that. Now we will hear from Vanessa Howard, who will share her thoughts on the resonance of this research to her work in rural British Columbia. Thank you very much.
Well, thank you so much, Amanda. Thank you for sharing your research, and I'll just share my screen. Please let me know if there are any issues with this, but hopefully you're all able to see it okay. And there's no boxes. Fantastic.
No boxes.
Okay, thank you. And I am really grateful to be here today and to share my learnings with all of you. I'm looking forward to our question and answer segment at the end of the session and hearing the discussion that comes from it. I'm calling today from the traditional territories of the Qualicum First Nation and the Pentlatch speaking peoples. I recognize that colonialism has resulted in difficult to quantify harms, and Indigenous peoples still experience Indigenous specific racism within healthcare and many other colonial structures, including emergency management. My intention for this presentation today is to share some of the experiences I have been fortunate enough to have and to share some of the lessons I've learned from working in communities in order to inspire us all to take an active role in critiquing existing colonial structures and proposing new ways forward that are anchored in respect and humility. The information and recommendations Amanda has presented echoes my experiences working within rural and remote communities throughout Canada. I agree with Amanda. We can do better for rural Canada. And in many cases, there are numerous professionals who already are. Over the last several years, I've been humbled to work with communities to build programs that transition the language of emergency management into existing strengths and community capacity. I've carried these lessons with me, and now I'm applying them within a health emergency management context. I have been so fortunate to learn from communities across Canada. I have learned so much by sitting with community leaders and elders in remote First Nations, where we traveled by water taxi to discuss emergency management on their docks. Listening to ranchers in rural ranching communities, discussing their local land-based knowledge and their challenges interacting and being believed by urban emergency management decision makers. The community CIO, who doubles or sometimes triples as the emergency program coordinator and the emergency support services director, or most recently, from the local 80-year-old who engages in everything from the local RCMP victim services program to pretty much running the emergency program, all the while still finding funding for the local health clinic to get the generator so that they can continue to operate during regular power outages. And where I found success, regardless of the community, province, or emergency management context, has been when we've used these anchoring principles: respect, humility, lifting up community leaders, and that can be health directors, emergency management leaders, or overall leadership teams, and really understanding that historical context influences today's interactions. Within emergency management, we often talk about community-led. However, it's not always applied. Practically and literally, community-led means that emergency management and community resilience in rural and remote communities should be developed and led by the community. Yet, we still have barriers. Many communities, especially rural Indigenous communities, public safety and emergency management has previously been considered the responsibility of other agencies or organizations. So communities are faced with the challenge of building emergency management programs without teams of people trained in emergency management. This challenge is compounded by the lens which emergency management has historically viewed community-led initiatives or non-traditional response activities. These community members have often experienced displacement without meaningful communication, exclusion from response and recovery decisions, and other harms in the name of public safety. And I understand many of these cases, these decisions were made for very valid reasons, but it's really important to understand the perspective of the impacted community related to these kinds of events. This is true of health as well as community emergencies, which of course, as we know, are often very tightly intertwined. And ultimately, I have found success in my work in rural communities by fully buying into the concept that the community I am working with is the definitive expert on themselves. This means that now the task is to ask pertinent questions and listen to those experts speak. These experts may include elders and knowledge keepers, but also other community leaders, youth, marginalized community members who are not traditionally engaged with. And when listening, I have learned to use a capacity perspective and a trauma-informed approach, both from a process and a communication lens, to ensure that traditional barriers to engagement and understanding are being actively removed as part of our process. And this has allowed me to learn, and those I've worked with to learn, that communities have those skills required for successful emergency management. However, sometimes we have to pull those capacities from less traditional methods or areas than when working with a community that's had the luxury of having full emergency management, public works, or public safety teams embedded in their history for years. And so as I've transitioned to healthcare emergency management from a more community-facing emergency management, many of those rural challenges were consistent. Urban-centric decision-making and power dynamics influence how emergency management was actioned and perceived within rural healthcare teams. Emergency management's hierarchical systems can be in conflict with healthcare's visions and values. And by applying them, we're not only eroding trust, we're also missing out on that expert voice, that local expert voice. And so I started reflecting on what I've heard and what I've learned, which is that we need to ensure effective and supportive response that addresses power imbalances, maintains respect, trusts that the local leader is the expert, and to do so through humility, while still adhering to time-tested principles of emergency management that allows frontline managers to have a mechanism for organizational support, logistics support, and tracking the people and financial process that'd be working outside of normal bureaucracy. I was very fortunate to be able to work on a response that allowed me to explore this more deeply within a healthcare context. And within that, we really needed to be able to visualize how we'd work together. And clearly the traditional command and control structures from the incident command system on the left-hand side of the screen were not appropriate. Yet, we still needed to have a delineation of roles and a structure for us to work within during a response. Of course, we're often working with people we're unfamiliar with and making decisions that are time-bound and consequential. Emergency management structures are designed to support team members while working outside of their normal lanes. And as we're starting this work, I kept going back to a conversation I had with a Confederate tribe leader in Oregon who was talking about their frustration with FEMA, the federal emergency management agency in the United States, who was using Indigenous art or words to make the incident command system more palatable, without recognizing that, as they described, it's just not how we'd make decisions. So we needed a new way forward, and this visual on the right shows my first attempt to reframe how we center the response and supports around community, leveraging the Emergency Operations Center as needed to enhance supports requested by local health teams. And I recognize this is not fully novel. Many people are looking at the way we manage emergencies and to use a community-centric approach. This is simply one visual that we used in a recent response to aid in the conceptualization of such a response approach. And through this work, my observations were that regardless of the context, holding up community is powerful. Authentic versus inauthentic support is recognized. Support is meaningful when it is community-led, because we're truly listening to the community and those experts, even when we don't necessarily agree with their approach. And when we do this, it's noticed, and it has powerful impacts, including improved working and personal relationships that in my circumstances have kind of lasted far beyond the response. But also patience is necessary. Community decision makers may be grieving. The community-led decisions need to allow for that process so the timelines are not as you'd normally expect them to be. And we can support this by managing the expectations of other agencies we interface with. Also, the response may be influenced by how communities interact with their leadership. Sometimes there'll be different views and stigmas related to harm reduction or mental health that may be realities that you'll be working within. And the way you address these challenges should be informed by local community and health subject matter experts. And of course, psychological support is essential. During all responses, care for impacted people is critical. These are often high consequence events that result in significant disruptions. When we consider the rural context, there may be significant interconnectedness. Responders are often directly experiencing losses as well. And finally, demobilization is also really important to consider. The impacts may reverberate through the community long after that acute phase of response is over, and management of new processes, new expectations, and capacity need to be embedded within the response demobilization before we consider that we are truly demobilized from that response. And so thank you so much. With that, I'm going to pause and stop sharing my screen so we can go back to the question and answer period.